In HealthWorks this morning, during this story, 3 people in the United States will have a stroke just during this next story, and 1 person will die. And now this medical crisis is hitting more and more younger Americans. The doctor explains why that is happening to people under the age of 50.
If you know someone who's had a stroke, you know the symptoms can be very subtle or very bold. Since May is Stroke Awareness Month, Cleveland Clinic neurologist Abbas Corral reminds us everyone should know the symptoms and anyone can have one.
No age group is immune to having strokes. Stroke can happen to any age group, and we're surprisingly seeing a significant rise in strokes in young adults.
A stroke occurs when there's an issue with blood flow to part of the brain, whether that be to a lack of blood supply or bleeding in the brain. It's important to remember the acronym FAST to recognize some of the symptoms of a stroke. F is for face drooping, A is for arm weakness, S is for speech difficulty, and T is a reminder that it's time to call 911. It's critical to seek immediate medical attention because strokes can cause permanent damage or death if treatment is delayed. According to Dr. Corral, younger people who experience stroke symptoms will sometimes put off getting help because they think it's something less serious. He says lifestyle choices might be one of the biggest reasons why more people under 50 are in fact having strokes.
Particularly in younger adults, we're seeing a significant rise in premature atherosclerosis, which is hardening and blockages in blood vessels. That is specifically believed to be due to a rise in the vascular risk factors of stroke that are occurring in more and more younger patients. We're seeing the incidence of high blood pressure, high cholesterol, diabetes, things like that were initially attributed to a much older age population that are occurring now in much younger patients in their late 20s and into their early 30s.
So a couple things to think about leading to stroke. In addition to high blood pressure, we talked about that last week, know your numbers because going to the doctor once a year, if you go to the doctor once a year, that's not enough for blood pressure monitoring. Clotting disorders can cause a stroke, structural heart disease, blood vessel abnormalities, recreational drug use in some cases. So doctor says healthy lifestyle and keep up with those annual doctor visits to try and keep tabs on what's going on to help reduce your risk of having a stroke.